Good afternoon, everybody. How's everybody doing? I hope everybody's had a great weekend leading up to another weekend, because this is on the Thursday. So we are always excited as we get closer to the weekend. I know I am very excited these days, I'm telling you. So we're still awaiting Sam. I don't think we have a quorum yet. Doesn't look that way. I see. So
yeah, the RSVPs indicate that we will, but we're not quite there yet.
All right,
good morning, everyone. I will need to leave the meeting at about 12:30.
All right, thank you for letting us know, Sandra. I appreciate it. Thank you. So we're gonna try. Do we have, Sam, do we have some things on the agenda that need to be approved by any chance by the board?
Yes, 3 items: the minutes, a new member, and then the 2020 board meeting schedule.
Okay, all right. So let's give it about around about hopefully 2 more minutes. We're hoping that way we can see if we can have. Did you hear from Janet? I don't see her on here yet.
Not today, but she did say that she thought she was going to be able to attend, and I haven't heard otherwise since she sent that email.
Okay.
I can text her. Tanika, give me a second.
All right, thank you. And then we'll give it a few more minutes before we get started.
I can't hear anything.
I don't think anyone's talking. I don't think. Oh. Mr. Linda and Tracy, put yourself on mute. We can hear you. Okay, Janet should be joining us shortly. She's working on joining. So let's see here.
Tracy and Delinda, would you mind turning your cameras off until it's time to present? Just so I can get a count of quorum. Thank you. And then if I could ask our board members to go ahead and turn their cameras on and keep those on, so I can get a quorum count until we get through all of the voting items. Thank you. Okay, we should have quorum right now. Looks like we've got 13 board members.
I don't see Janet as of yet, but,
Krabowitz.
oh, there she is. There she is. Janet is, okay. All right. Janet, we do have one of our board members that has to actually jump off at 12:30. So if we can go ahead and start the actual meeting. Can
Do you all hear me?
Yes.
You do. Thank you. Thank you.
Can you hear us? Janet, can you hear us? I don't think she can hear us.
Hey, Jeffrey. Say something, please.
We-
I may have to put in, nah, I don't hear you. Hold on. Shucks, what did I do with those? Hold on. Not muted. Hey, look here a minute. You know WebEx? Okay.
Jeffrey was muted when he was speaking.
They hear me, but I don't hear them. I may
Yeah,
have
we
to,
can't
I
hear
wonder if I have
anything.
to put in. Oh, wait a minute, let me pull it back up. Hold on. See, it's not muted. The video's going.
Well, so what's the,
If I do. Hold on.
what about the volume?
Thank you, thank you, thank you. You know, I
Is
always,
that what? I know that's the volume.
no, I think it's down here. Hold on. I think he always turns it off. Yes, he had turned it off. Swanee River. Hey, Jeffrey, say something again, please.
Good, let's say
Hey.
good morning.
Thank you. Thank you. No, it is not morning. Friends, I am on beach time. I am like whoever up there has that beach photograph for us. Before we end the meeting, I'll go out and I'll show you all the ocean.
It's a beautiful thing. We would love to see it, Janet.
Well,
Nowadays.
It has finally stopped raining, so today would be a day to look.
All right, Janet, we'll kick it off. It's 12:09. We do have a board member that has to leave by 12:30. So we need to go ahead and get all the items that need to be voted on.
Okay,
right now. Okay,
let's do it. And so hold on, let me do one thing, Swanee. Hold on just a second, you guys, and I'm gonna be right back. Because I don't have my agenda in front of me. So give me 1 second. I'm sorry, y'all. And so while I'm doing that, if you all have your agendas in front of you, please take a look at the purpose.
The promise of community action.
Yes, the promise of community action. Jeffrey, you are my voice today. I appreciate it. Hold on. Let me go over here.
Janet Sims, sharing her screen to show you the agenda.
Thank you. Then let me go back over here. Thank you, thank you, thank you. Y'all, we are called to order. As if we were not in order. Welcome to everybody. Thank you all for being here. And let me ask, because I don't have all the photos on my screen, do we have a quorum?
Yes.
Yes,
We do. So swell. So everybody, if you would please take a minute and look at the minutes from our previous board meeting, our August board meeting. And take a minute just to review, if you would. And when everyone's had a chance to review, if someone would please make a motion to approve those minutes. But actually, before I do that, any corrections for anybody?
This is Troy. I move approval.
Troy, you need to sound more excited about it.
This is Jeffrey. I'll second the motion.
Thank you. All in favor? Show with a sign of hands,
Aye.
please. Any opposed? Any abstentions? Thank you. The minutes stand approved. We have two other items here for our review and our approval. We have a new board member who is not with us today. He will begin joining meetings in 2022. Can you believe we're saying 2022? Boy, he will be joining us then. Marcus Stubbs and Sam or Tamika, anything that you would like to say about Marcus?
Yes, absolutely, Janet. Thank you. So we have the pleasure of inviting Marcus Stubbs to join our board. I hope that you will all say yes. It should be in your packet, his actual bio. It's very impressive in the most, as far as everything he has done in our community and then around education. As you know, Marcus was born and raised in Louisville, Kentucky. I'll just do a quick overview. He's married with a lovely wife, was great to hear. He graduated from Western Kentucky, has a bachelor's in disciplinary studies and social behavior, which fits right in with our community and what we're dealing with. So it's excellent that we can have his expertise on our board in order to share his view and feedback and hopefully lead us for recommendations moving forward that will have more success and impact in our community. I try to keep it very short, but it's very extensive and dense. So if you all can take a look at that bio, if there's any questions, we will definitely be able to answer. But yet, I hope the board will take this in consideration and vote for Marcus Stubbs to be a part of the Community Action Agency.
And Marcus comes in as a community member, is that correct, Tamika?
That is correct. He is a community member.
Right. And that has been a place, you all, where we have had vacancies, and the staff has really been working hard to fill those community vacancies particularly. Any questions for anybody?
I do. I have a question. What area is he representing?
I believe he's coming in as a community member.
So he's just,
Yeah, He'll be in,
What-
right, he'll
statewide?
be in the community sector. He'll be
As
in the
opposed-
community sector, Jacqueline,
As opposed to public or private.
private. We
Okay,
have three, our board is set up on a tripartisan, so we have three areas. Government, private, and then community. So
okay,
we have to have representation of all three on our board.
right. I know I'm a community representative, but I was just curious because mostly I live in the West End, so most of my concerns and issues that come from community come from the West End. That's why I was asking, is it a particular geographical area that he would be serving?
Oh, gotcha.
Oh, okay.
Yes.
No,
That-
we haven't, he's not assigned to a specific area, like, you know, some of our community sector members are assigned to like a specific neighborhood place or that area like that. That's not the case for this seat. Still community sector though.
All right, thank you. Okay.
Great. Any other questions? And if not, I'll accept a motion to approve acceptance of Marcus Stubbs as a board member of the agency, of the board. Excuse me, member of the board.
If Jeffrey, I'd be happy to move to accept Marcus as a new member. He sounds great.
And
Terrific.
I will second it, and Ben Langley, second.
Thank you, Ben. All in favor, please, with the show of hands on the screen. Thank you. Any opposed? Any abstentions? Well, great. Marcus, we welcome you in abstention here today and look forward to meeting you after the new year. Sam had also put up, I believe, a recommended schedule for board meetings for the year 2022. Did you all see that, or if it can come back up on the screen for a minute?
Yeah, give me just a second here.
Okay, sure. As you all recall, we meet every other month for an hour and a half. We will have a December meeting, which would mean the first meeting in 2022 would be in February, and then alternating after that.
Sorry about that.
No, that's great. Y'all can scroll down through that. Any questions about this, you all? As I recall, last year we did, the staff did a survey to see if people preferred like a morning, an after work, a middle of the day. And I think, Sam, I'm going from memory, but it was resounding that people wanted to meet in the middle of the day. And so we have stuck with that schedule at this point. All righty. So any questions for anybody? Then again, I'll accept a motion to approve the list of board meeting dates for calendar year 2022.
I'm more excited this time. Let's do this meeting agenda.
Way to go, Troy. Now, somebody, you've got to outdo Troy with your enthusiasm about a second.
I don't know about that, but I'll second it.
Okay, thank you. All in favor, show of the hands, please. Any opposed? Any abstentions? All righty, great. So we have those items. Who needs to leave at 12:30?
That's me.
That's me. That's me, Sandra.
Oh, okay, Sandra. Thank you, Sandra. Great. We will miss you when you head out, but thank you for being here for these agenda items. Let's move on now. And Sam, would you like to talk about the customer satisfaction report?
Yes, I would. Give me just a second here. Share my screen.
If you take too long, Sam, we'll all be dissatisfied.
I know. Too bad you have the link. You could fill that out and let us know that. Okay.
Sam, what does this graphic represent? Is it showing a
Oh.
survey in back of it?
Oh, it's just a computer like data, basically. It's just
okay.
generic, nothing fancy. Okay, so hey everybody. So I'm gonna just take like 5 minutes and go over our customer satisfaction results as required per the organizational standards. So for the past 6 months or so, we've been working on implementing a new customer feedback system for RCS with the hopes of improving customer engagement and response rates. So the system was implemented in early September of this year, and it allows customers to access the survey in multiple ways. The online survey is hosted by Survey123, and it's available in Arabic, English, and Spanish. And customers can access the online survey via direct link or by scanning a QR code. Customers can also access the online survey via SMS text message. So basically, customers text the word survey to a dedicated number, and then they receive a link to the survey, which then they can complete on their mobile phones. So this is an entirely new approach for us, the text message thing. We're hoping that it's going to help boost our response rates. And on the slide here, you can kind of see what it looks like when a customer initiates the survey via text on the right there. And then so far, 14 customers have utilized this option. We want to just continue to keep an eye on this to ensure that the texting platform that we are utilizing continues to be cost effective. And we also make available a paper survey for those customers with technology barriers. And paper surveys are available in a number of languages, including Arabic and English. Somali, Spanish, and Vietnamese, and those are just a few. I think Mandarin is another one there. Now, because the system has just been implemented, we only had 17 responses at the time I pulled this report together. As of yesterday, when I last checked, I think that number was up to 22. However, this is still a pretty significant increase from our old system where we were basically just using a SurveyMonkey link and where we rarely saw new responses coming through on a regular basis. So one of the first questions that we ask on the survey is what types of services the customer received during their visit. So 53% of respondents said that they received services around financial planning and empowerment. 24% received housing related services, 18% received LIHEAP, and 18% received case management services. I mean, there is overlap there. So respondents to this question are able to select multiple services. So one respondent may have received financial planning services and housing services during the same visit. So for the rest of the questions on the survey, respondents are given a statement and then asked to select how strongly they agree or disagree with that statement. So 82% of respondents felt that the services they received were conveniently located and accessible, and that remaining 18% selected neither agree nor disagree or not applicable. So no one disagreed or strongly disagreed with that. And then 94% said they felt that they were served in a timely manner. 100% of respondents felt that staff were patient, courteous, and helpful. And then of these, 82% strongly agreed with this statement. And then when asked if they were treated fairly and equitably, 94% said that they were. This is a new question that we added. And then the remaining 6% said that they neither agreed nor disagreed with the statement. 100% of respondents received services to address their primary need or concern. And then 100% of respondents who had additional needs beyond the services provided said that staff helped them form a plan to address these needs. So of these respondents, 58%, for example, received one or more referrals, and then 42% received a follow-up appointment. Finally, when presented with the statement, I am satisfied with the overall quality of service I received. Approximately 71% of respondents selected strongly agree, 23% selected agree, and 6% selected neither agree nor disagree. And then the final question is open-ended, and it asks respondents to provide any additional comments that they would like to share. And so I just included a couple of those responses there. So that's pretty much it. I think that the next steps for us will be to continue to push the survey and make sure that it's accessible to all customers. So regardless of whether their experience is good or not so good, because we're not just, collecting this to meet an organizational standard. We actually want to use the data to identify opportunities for improvement and then actually make those improvements where we can. Right now, all client-facing programs include the flyer that you saw on the second slide, that blue one on the left, as part of their intake paperwork packets. And we also place the flyers in reception areas so that they're visible. And moving forward, we're looking to pilot a sort of like a kiosk at the Edison Center in the hopes of improving survey engagement. So basically, we would plan on setting up an iPad or some other type of tablet in the reception area of Edison so that on their way out, customers can complete the survey that way as well. And then if we find that this is effective, we would then consider rolling this out to other sites like the neighborhood places potentially. So now I'm just gonna, open it up to board questions or suggestions. In particular, I'd very much like to solicit your feedback here. Do you all collect customer feedback data? And if so, do you have any suggestions for us so that we can increase our response rate or, maintain a steady response throughout the year?
Hey,
Any
Sam,
questions or
Gregory.
feedback? Sorry, go ahead.
Yeah. I don't know that it's at all helpful. You all may have, you've got a somewhat similar but somewhat different customer base than TARC does. And it would be more difficult, I'm sure, to reach. And given the method we use, which is we hire, not annually, but every few years, a survey research firm. And they typically, the last few have done a brilliant job of random sampling, both on board and to the community at large. And they've been extensive surveys that give us a lot of discrete, detailed information about perception of service. We found that very helpful, but again, I don't know, given your circumstances, whether you could use a survey research firm or whether there would be the budget for that kind of thing. It's not an inexpensive undertaking. Just want to mention it.
Yeah, thank you for mentioning that. Yeah, I think so do they do it okay, so they're doing a sample. I think one of the things, just based on the organizational standards for CSBG, is that we want to make sure that anyone can complete the survey once they've, been served. But I don't know if there's maybe an opportunity to kind of have an additional push, at a certain time of year. So yeah, I'm going to make a note of that. Thank you.
It's a different purpose, right? I mean, the advantage of using a statistical sample is that you can very accurately represent the entire population that you serve.
Right.
By just sampling a portion. It's a relatively small portion too, like 1%.
Go ahead, Troy. It looks like you have something.
I was just going to say, I mean, that's not a very big sample based on the number of people you serve. And of course, through the pandemic, it's been really tricky, to get responses when you're really not seeing people as face-to-face. But I would recommend in the future, I mean, you have a database of everybody you've served. You can do a random sample and you could either have someone call and do the survey by phone, or you could send out something with a return address envelope or send something with a link. It just takes a little more work, but I mean, I know this last year, you're lucky to get, it's difficult through the pandemic. We're not really, I mean, our facility is not just open. We're only seeing clients by appointment and in limited numbers. So, but just for the future, that would be my comment, that you really need more than that based on the number of people that, and the amount of money that's being spent through these programs to have 25 or less responses. Of course, it's great that they were good responses, because usually when you just get a 10% number, it's like, the mad people. So,
Yeah.
so that's
Yeah.
good.
Yeah, and that's what we are looking, that's a great point. It's only been a month and a half, but still, like, these things always kind of start out and then they, you can slowly see, if you're not like kind of continuing to push it, the response rate go down. And we really don't want to see that. And we want to make sure that the feedback is representative. So yeah, that's a really good suggestion. Thank you.
And then also, just to let you all know, we are trying to, of course, everything now is electronic, and everybody's pushing for everything to be electronic in the way we do business. But before we actually had this electronic survey, we did everything through paper. Ben at the neighborhood places, he knows exactly what we used to push out every year to try to get as many customer service surveys. And we used to do it in one distinct time period.
Yes.
So now we're trying to be able to have the customer service survey just all the time. So this is be something that we are looking forward to actually review and actually have trends of the data analysis instead of looking at it for one distinct time period within a fiscal year. So because of the standards, we're trying to make sure we have that ongoing customer service base, and then also making sure that the service delivery that we're providing is very effective and efficient. We're working on adding an actual kiosk to our reception area too. We want to see, as those individuals that gradually come in for appointments, we want to be able to capture them as well on their way out the door. So we're trying to do a little bit about what JCPS does and et cetera around their surveys too.
Right. Tamika, if I could add to that. So we have, through Neighborhood Place Operations, we meet every Friday. We have the wonderful Cassandra Miller with us every week. And we've got Jennifer Bowman from the health department that is also with us, and other partners. So we have got iPads, but we haven't put that back out in the lobby because of COVID. But we also have QR codes, Sam. So I'm glad you're using that, because it seems like that's a safe way for people to take surveys. We have our self-assessment form, which is also called the bubble sheet with Neighborhood Place. And that's kind of what Tamika was referring to as well, that when families come and receive services at Neighborhood Place, they're able to scan a QR code, and then they're able to let us know why they are there. So I think that is the way to go. And we are rolling that out even as we speak in our Neighborhood Places and in the lobbies. So we'll see how that works with this pandemic. So, but Sam, I think you're definitely going in the right direction.
I might, Ben, reach out to you in a couple weeks and pick your brain about some of this.
Sure.
Like, the iPad stuff, because I know that for a while there was, before the pandemic, they were piloting, like, I think it was like the welcome survey and doing that on the
Yes,
iPad.
that is
Yeah.
right. And I've got
And
all the
then-
stands. I have all the iPads, but yeah, we need to figure out how to do that
Yeah.
in a safe way. So
Yeah. Thank you, Ben.
yeah.
Sarah, did you send something? I saw something on the screen that had your name on it, and so, but it went off before I could read it.
Yeah, sorry, I've got to hang up here and run to another meeting, but I know a lot of you, I think, are already partnering with us on our Say Yes to Test program that we have for the next month. I put the link in the chat. But if you are a community partner and you want to help us pass out tests, shoot me an email. We'll get you connected. If not, just share that website with your partners or with your clients and get them to enter in their address, and we'll ship tests to their house. They get 8 tests. I'm hoping that they'll test twice a week for the next month. It's part of an NIH kind of research study to see if that helps people change behavior and helps us drive numbers down quicker. But it's the zip codes we are targeting are all the same people you all are serving. So just appreciate you all helping us to share that. And then I just put the link to the COVID data as well too.
Great.
Before I have to hang up. So I apologize.
Sarah, before you pop off, do you have a minute or two update for all of us?
No, I mean, numbers are going down. Just hope they go down a lot more before they might go up in winter. We're hoping kids 5 to 11 will be approved in the next month. And that'll help us a lot for vaccination. Hopefully help drive those numbers down more. So, just, yeah, same stuff. Just trying to get the message across still. Masks and spacing, vaccination all work great. So hopefully that'll get us to the post-pandemic world.
Are you all giving flu shots out the wazoo too?
We're not. So the health department stopped most of our clinical services. We're doing the COVID vaccine because of the pandemic. But if you go to flu.gov, you can find where you can find a flu shot near you. They're same places most of the COVID vaccines now. Almost every doctor's office, pharmacy, grocery store, they're out there. Schools. But yeah, get your flu shot. We already are seeing flu. So please get your flu shots.
Great.
Dr.
Thank you.
Moyer, we appreciate you using Neighborhood Place as also a vaccine site. So that's worked out really good. So I thank you and your staff for doing that.
Great. Yeah, we are trying anything to get that last 40% of our population vaccinated. So appreciate you letting us partner there.
Yes, we're definitely with you on that.
Great. Sam, any or let me ask, does anybody else have any more input for Sam? Okay, great. Juan, here yet. I'm not seeing you on my screen yet, but Juan is going to talk a little bit about the financial report, you all.
Good afternoon, everyone. Well, first, I want to say my apologies for not sending you the report before the meeting. I'm juggling 5 different things here, positions, so I apologize, but you will get it today, okay? I just need to do some format cleanup and I'll send it over to you all. But one thing I do want to update you on, local metro government has not closed the books for FY21 yet. So we're still waiting on a final close. Things are still posting to the call centers, far as JVs and things of that nature. But we are not paying anything in FY21. So we're hoping to get, something saying, hey, books are closed, and I can give you an update on how we did for 21. In 22, for through October 21, remember it's a point in time. When I send the report, you will see that our budget right now is a little over $70.8 million. We have expended $19.7 million, and we're still spending. In comparison to the July, we were, I think, when I last checked, we were only at 1.9, I think, in the beginning. But we have a remaining balance of $47.8 million. But please keep in mind, they're still carrying forward funds. So I expect that to increase up to the 100 millions almost with the COVID funds coming in. But I will send this out. If you all have any questions, I will make sure Sam includes my email address and let me know if I can answer anything for you. But you all have a great day.
Thank you, Juan. Any questions for anybody here before she signs off? Thank you, Juan. We're going to move on now, you all, to the programmatic reports, and Tracy Collins is going to talk a little bit about the foster grandparent program.
Can't hear you yet. Let me mute yourself.
Oh, sorry. Sorry, can you hear me?
Yes, we
Yes.
We can
I'm
hear you now,
sorry.
Tracy. It's okay. Go ahead.
Okay, good. Yeah, I'm sorry. Hi, my name is Tracy Collins. I am the foster grandparent coordinator. And the purpose of my presentation today is to showcase our program that provides an opportunity for adults 55 and over to have a positive impact in our community. Sam, I have a slide. Sam, do you have this slide up for me, please?
I have the slides up. You just need to let me know when you need to go to the next
Next
one.
slide.
I'm on the first slide.
Okay, slide. You can go to slide 2, please. The foster, I'm sorry. Okay. The foster grandparent program, is that slide number 2? The foster grandparent program will celebrate 50 years. Excited about that. As of July 2021, this year, the foster grandparent, along with the, was awarded federal funding along with matching funds from Louisville Metro government for another 3 years. Our program staff consists of 3 staff members, and that's the program coordinator, volunteer coordinator, and 2 administrative support people. Next slide, please. As you can see, the foster grandparent program has a total of 28 partnering sites in Jefferson County. Post-COVID, only 19 sites reopened to the volunteers as of September 2021. Next slide, please. Is that the next slide, Sam?
Yes, it is.
As you can see, okay, thank you. As you can see on the participant statistics, the foster grandparent program has 106 active volunteers and 40 applicants of interest on the waiting list. Our program capacity, or our program enrollment, is 125. To date, we have volunteers that are currently serving, 67 volunteers are currently serving in 16 of the 21 Jefferson County elementary schools and 3 child care centers. Next slide, please. Who can be a foster grandparent? Well, as you can see here, the age requirement is 55 years of older. You have to meet the income requirements of 200% of the poverty guideline. You definitely have to clear all state and federal national background checks, and able to serve, be physically fit and able to serve a minimum of at least 15 hours per week. The benefits for being a foster grandparent is that you receive a small stipend that is given to all eligible volunteers to help to offset the cost of volunteering. And other benefits include pre-orientation training, and then monthly training, accident and liability insurance, transportation, and meal reimbursement, all given to those that are eligible once they meet all the requirements. Slide number 6, please. As you can see here, according to the Nonprofit Leadership Center, post-pandemic, 406,000 hours of service were given from our volunteers, which has a community value of approximately $11.6 million. That is huge, because some in the past. And sometimes people ask if these intergenerational programs really work or have an impact. And as you can see here, it has a huge impact to our community. Next slide, please. And into that, the teacher survey results. We send results out to our teachers and our coordinators. And according to the teacher results that you can see, is very impactful. It shows the effectiveness of the schools, and it rates the effectiveness of the importance of having a volunteer that has worked in their school or in the child care center. And these results help us to gauge, what trainings are needed, or, what skill areas need to be improved in. So next slide, please. The next slide is our program outcomes. The foster grandparents work at least 15 hours per week and provide one-on-one guidance to children and youth in the classroom. And as you can see, the results here, it shows the importance of, or the improved, the children that are assigned to a foster grandparent volunteer shows the percentage of improved or in identified priority areas that move them to the next level are kindergarten. And the other one shows 1st through 8th grade are really to 5th grade that are assigned to a foster grandparent that demonstrate an increase in their academic achievement in areas that are identified by the teacher. Next slide, please. How has COVID affected us in the program? As you can see, it has affected us through, it has affected us through the not being able to provide service to children and youth. It has affected us through the early childhood settings and not receiving the social and development that they have in order to reach the next class level or kindergarten. And it also caused cancellation in our in-service trainings, which help volunteers to raise their skill level and receive the social interaction, which is so critical to most seniors, who suffer from isolation, who may not have a regular contact with their family members. And it also prevented us from recruiting much needed help, adding additional volunteers to our program to help with the list that we have of teachers or schools waiting to get additional volunteers to help with students. And the solution is that the corporation allow for temporary, continue with their temporary stipends, which continue to help our volunteers throughout the year. And it also allowed them to get access and get information for vaccines. And currently 98% of our foster grandparent volunteers, which we are excited about, are all vaccinated, fully vaccinated. And this enables them to get back into the classroom.
To participate in the program, Tracy, does it require vaccination since this is federally funded?
No, we cannot require them. We can't mandate. We can basically suggest, but that we haven't gotten that information yet. That hasn't come down to mandate them. We haven't gotten that information yet. So we are just strongly encouraging. Let's say that we are strongly encouraging them.
Thank you.
And I know I talk fast, but this is the end of the next slide, please. This is the end of my presentation. And how can you help? We need help in finding a place for us to do our in-services every other month. We have, like I said, approximately 125 volunteers that are seniors. So the place that we need to have, it has to be accessible for seniors. And, been able to, get there maybe on the bus line if they have transportation, and if they ride public transportation, just to be able to get there. So we're looking for a place to have our sites. So if you all can help us on that, that'd be wonderful. With any suggestions, and also to help with basic computer training, our basic training about, just basic computer training as far as tablets are concerned. That has been a big issue because most of our volunteers don't have access, don't have internet access, and are not able to help and be an additional asset when maybe in class learning or when they do remote learning. So that is a big need that we have to have someone coming out and help us with the basic training of our seniors.
Do you have a location for that training?
No, not yet, no.
Okay, and do you have, do you have the tablets?
No, we don't have the tablets either. So,
Okay.
yes, but just some kind of way, because we want to get them tablets and we're looking to do that. But I want to make sure that they are comfortable and able to, work the tablet, able to get on, and also they, help with Zoom with us, as well. If need to, we can do Zoom meetings as well, do Zoom training.
Right. This is Tracy, for you and for Sam. Could you also send an email out to board members about this? And Tracy, could you detail, like, for example, for the location for training, do you need, I'm going to assume it needs to be accessible to disabled parties? Do you need kitchen space for food? All the needs that you would have for space. And then if you need help in terms of those
Okay.
tablets, if you could put that on there, there are a number of people who are not here today, and it would be great for them to see that outside of the minutes.
Okay, great. I
Thank
sure
you.
will. Now I'll
Thank
make
you.
sure Sam gets that, and thank you so much. And thank you all for allowing me this time.
Anybody else have any questions for Tracy?
Hey, Tracy, how would a person that would be interested in being a foster parent, grandparent, how would they go about applying?
Do is call Delinda Taylor, who is our volunteer coordinator. I can make sure you all can get the telephone number, and she'll be more than happy to help, and she'll give information and to see if you're income eligible to be in the program. So just contact our volunteer coordinator, Delinda Taylor, and she's at 574-1933.
So it is an income guideline?
Yes, ma'am. It's 200% of the poverty level.
Okay. And
So say for instance, if it's a household of one, it'll be probably $24,000. But also, it's our program guidelines and does not affect, or your income does not affect any other services or income that you may be getting. Say for instance, Social Security or food stamps, or any, if you're living in public housing, it does not affect, because since they do get a stipend, and our stipends are $3 an hour, it doesn't affect other public, income or anything that they're getting.
okay. And the other thing,
Considered a reimbursement.
this is not a question, it's kind of a comment. I have.
I'm sorry,
printed
you're
out
going
the-
in and out. I can't hear you.
I'm sorry. I had printed out the agenda, so I had saw where you was asking for a place to hold the meetings. I'm working on
Mhm.
something. Our church has a facility that is big enough to host 140 people. And they also have
Oh,
breakout
wonderful.
rooms in case you need breakout rooms. So I'm waiting on him to
Okay.
get back with me to find out if you all can rent that space. And I'll give you his contact. I'll send you his name and contact information once I hear back from him. Okay?
Oh, that's awesome. Thank you so much.
And it's also
appreciate
a
that.
handicap accessible, it's no stairs or anything. You can just walk, you can park it,
Okay.
it has a parking lot, and you just walk right in the building, so it's no stairs or anything that they have to climb.
That's great,
Okay, great.
Jackie.
Thank you.
Okay,
Thank you,
All right.
Jackie.
okay, I'm done.
Troy, I think you had said something?
Yeah, I was just gonna say it doesn't affect their income base because it's considered like a reimbursement for travel and expenses. So it's a stipend, it's not income. And that's Because a lot of people are afraid they'll
Exactly.
lose benefits or something. So it's a really great program. They used to meet at Highlands Community Ministries, but our building is just not designed as
Yes, we
well
appreciate that.
as it needed to be
Yes.
for as many people that were using wheelchairs and so forth. But they're a lot of fun and we miss them. So I'll say that.
Yes. Yes, and Troy, thank you so much. Yes, we were there for a couple of years, actually. Wasn't it like a, and as we grew, it just, didn't become feasible anymore. But yeah, we definitely thank you, for allowing the time that we were there and the use of you all space.
Absolutely.
Great. Well, Tracy, thank you so much.
Okay, thank you all again. Thank you.
All righty. So here we are to the director's report. And Faith Isles and Sam Closey are going to talk a little bit about the strategic plan progress update and the Metro boards and, the training. That's right. That's coming up at the end of this month. Is that correct? So let's start with Faith, please.
Good
Hi, Faith.
afternoon, everyone. And I am unmuted. That's good. I frequently forget that. So in your board packets, you received the most current strategic plan. And from a strategic plan standpoint, the department, as you can all well imagine, is still in crisis management mode. Our primary focus continues to be on meeting the basic needs of the community with rental and utility assistance. We all thought in June that we would be fully open by now, but the Delta variant interrupted reopening plans. So we're just looking forward to getting past this critical phase and so that we can look forward to focusing on other strategic objectives down the road. So does anybody have any questions about this strategic plan update?
Questions or comments, anyone? Thank you, Faith. Appreciate it.
You're welcome.
Sam?
So yeah, I just wanted to remind everyone that the Metro boards and commissions, that they're holding a mandatory virtual training on October 26th from 9 to 11 a.m. The training is going to focus on ethics, open records, as well as board accountability and oversight. And for the Office of Boards and Commissions at Metro, all board members are required to attend this. So you all should have received a registration link from, I think, Chris Doolin on Monday, the 11th. You have to register to attend, so make sure that you do that. Once you register, you'll be sent instructions for joining the virtual training. If you are unable to participate on October 26th, please send me an email. Boards and Commissions has indicated that there will be another opportunity for you to satisfy the requirement if you can't attend on the 26th. And then I'll send an email with all of this information to everybody. Even though you've already gotten it, I'll kind of streamline it and send it to you. And I'll include the registration link in there, just so you have it at the top of your email. So I'll do that once we get out of here. And that's it from me.
Great. Great. I think we are at the end of our meeting. Am I correct, Sam?
Yep, that's it. Unless anyone else has announcements or, anything like that.
Any announcements? Comments, questions? Any jokes? You all want to see the beach? Hold on, I'll show, Swanee River. Whoop, hold on. I'll show you the beach here, y'all, before you go. Actually, I'll show you the Atlantic Ocean. I hope you'll be able to see it. Let's see. Is that too, can you see it?
I'm jealous. Yeah, Janet, we can see it and we're jealous.
Very
Totally
good.
jealous.
Y'all, these are the Outer Banks of North Carolina.
Wow.
Wow.
And believe it or not, the water is still warm enough to swim in.
Mm.
It
Oh,
is,
wow.
it's great. It's great. My husband is out fishing as we speak. So
Wow.
thank you, everybody. If I could have a motion to adjourn the meeting, please.
Motion that we adjourn, Ben Langley.
Thank you, Ben. Now, who is going to be as excited as Ben about
This is-
making a second?
This is Jackie.
Excited.
Jack-
Okay.
I seconded.
I second.
And we all agree. I'm taking our hands up for everybody. Thank you, everybody.
Thank you.
Stay safe, and we will be together again in December.
Yay.
Hey, have fun,
Thank you.
Janet. Outer Banks,
Oh,
one of my
thanks.
favorite
Thanks,
places.
guys. Good seeing you.
Is it Ben? Ben, where do you stay when you come down?
We usually stay around Duck.
Okay. We're
And,
down south.
That's just beautiful.
Yeah, we're in Buxton, and it is gorgeous.
I
If
know
you'll
Buxton,
out here.
yeah.
Believe it or not, this is our third week, but we leave tomorrow, so it is always hard to leave.
I understand. I ran the Outer Banks Marathon about 4 years ago and I loved every moment of being in the Outer Banks. Just beautiful.
Were you just on Highway 12 running?
They had us all over the place. So Highway 12, but then they took us out into different communities. It was beautiful. It was gorgeous.
Oh man, that's great. Gosh.
I'm just saying, yes. I'd love to be right over by you right now.
Yes, yes. I don't blame you. It's lovely.
Yeah.